Okay.
It's just, I apparently with Dawn's it didn't work.
Oh,
But
oh
oh my
no.
gosh. Thank you so much for joining me. Okay, so I'm
Yeah.
Gina. I'm from Wink. Is
Nice
your
to
name
meet
Kylie or Kaylee?
Keely. Keely.
Kaylee.
Keely.
Okay. Awesome. And so how many weeks are you right now?
I'm due this Thursday.
Wow, okay. So what's it like just being, a mother in this, like about to have, a baby? Is this your first?
No, this is my second.
Okay. What is it
Um,
like kind of in this time right now?
I mean, it's definitely been scary, like going to the doctors by yourself now. My husband Chris hasn't been allowed to come to any of the doctor's appointments, so he normally comes to every one. So that's kind of nerve wracking, just like knowing that we're already being denied that, and just like so when I was going to Premier Women's Care, and I had asked them, at this point, Chris isn't allowed to come to the doctors. Is there a chance he might not be allowed to come to the birth? And they said, yeah, there is a chance. We're hoping that that's not the case. But just knowing that in the back of my head, because I am having an all natural birth. I did it with my first one, and I plan on doing it with this one. And for me, a big thing is like removing fear. And so having that fear in the back of my head that Chris may not be able to attend was definitely bothering me. So that's when we called the midwife. And also with my first, I didn't do any medicine, but I did do the gas and air. And the hospitals just stopped allowing that because of COVID. So Dawn at Naples Birthing Center now has gas and air, so I'll be able to have that, and no matter what, I'll be able to have Chris with me. Plus, my daughter's 2 years old, so to be at the hospital for 2 to 3 days without her because she's not allowed to come there right now was a big thing weighing on my heart. So I feel a lot better going to Naples Birthing Center. I'm only going to be there for like 4 to 6 hours after I have the baby. I'll be able to use gas and air. Chris will be able to be there no matter what. So I definitely feel a lot better switching over.
That is insane. I was unaware about the gas and air at first.
Yeah, I guess
I'm just shutting this door right here.
oh, no worries. I guess with the gas and air, they're worried about it possibly like vaporizing. Like if a mom were to have COVID, the gas and air could vaporize it and make it like easier to spread. They don't really know the research on it, so they're just playing it safe. But for me, that's my only outlet. Like it's not a pain relief, but it is like a stress relief. The gas and air. So since I'm going all natural, I didn't want to be denied the one thing I was going to use. So it was perfect timing. Dawn just got her gas and air machine. So when I called, when I first got pregnant, I was going to have the baby at the Naples Birthing Center. That was my original plan. But she didn't have gas and air. So I just was like, okay, I'll just do it at the Cape Coral Hospital. And then the Cape Coral Hospital ended their gas and air program because of COVID, and then she got one. So it's kind of like it's all falling into place.
Yeah. Do you think right now, like, why do you think a lot of mothers, I mean, you had a natural birth before, but why do you think a lot of mothers are just kind of falling on this trend right now?
Well, if they have kids in the first place, if they have other children, they can get home to their children quicker because their children can't come to them at the hospital. Where before my daughter Marina, I had plans on her being there, the 3 to 4 days that we would be there after having the baby. But at a Naples, like at a birthing center, you can leave after 4 hours. So I know one reason is probably because of that, and then also just the less risk of infection. Less people coming in and out, less people that could possibly have COVID coming in and out of the hospital.
Yeah. What do you think? What is it like? Just what do you think it would be like not to have your husband there or your kids like there when your baby is being born?
It would be, it's, I feel terrible for the women who've already had to do it. I mean, it would be awful. With my first, Chris was as much a part of the labor that he could have been if he wasn't me. He was right there. I mean, he was everything I needed, and to not have him by my side, that the thought of that is a nightmare.
Yeah, definitely. And do you think that, I mean, have you heard of other mothers doing this stay at home kind of birthing right now?
Like birthing at home.
Yeah.
Yeah, I've actually it's kind of blowing up. Like I don't know anyone personally, but I'm on Facebook. I follow like pages where women are pregnant and just like talk to each other about things. And there's a lot of women right now looking into birthing at home, birthing at midwife centers, just to avoid hospitals right now at all costs because I wouldn't want to go to the hospital if I broke my toe right now, you know.
Yeah, and what do you think is just kind of like, there's obviously some scary issues that women feel with having a baby at home. What are some of those? Like, do you?
Oh, you're breaking up.
Oh, do you hear me now?
Yeah, I can hear you now. What'd you say?
You know about the downside of just having, like, what are some of the downsides, or like, if there are some health risks involved with having a home birth?
Yeah, I mean, of course, if anything, any medical emergency happens, then you're either going to have to ride in an ambulance to the hospital, or, I mean, depending on how far you are, it could be, you know, that could be really bad. Not having, like, if you were to hemorrhage, not having the support right there for you, that can be scary, you know. It's definitely scary that women are having to choose between going to a hospital where there's a COVID risk, or, you know, birthing at home where there's obviously the other risks, or just, you know, some people aren't comfortable in a birthing center. So, yeah, I mean, there's risk involved, and it's scary that women are being kind of like their backs against the wall, having to choose.
And this is such an interesting topic. What are some of the other things that we should be doing stories about with people? Like, what are some of your like concerns right now in this time? I can't imagine having a baby right now. You know?
Yeah, I mean, like no one's gonna come, like no one's gonna be able to meet my daughter when she's born. Um, I'm actually having a pediatrician come to my house once the baby's born. I'm not even able to take the baby to the doctor because of fear of risk. So that's another thing. Like I feel like babies aren't seeing pediatricians enough right now. Like they're being born and then probably not getting their ear tests, probably not getting, you know, their proper weight measurements because, you know, right now people would just rather play it safe and be home than go get those things done. So I'm paying to have a pediatrician come to my house. So just things like that. I mean, it's really hard, but for me, like I'm practicing, I do hypnobirthing is the type of birth I'm having. Like I had a hypnobirth with my first one, and then I'm having a hypnobirth with this one, which is just like meditation and removal of fear. So I guess that's just kind of like my focus right now, like just removing the fear from it and like focusing on the positive, and that like yes, I couldn't have it at have the baby at the hospital, but there was a plan B, you know. And so I recommend to all women who are pregnant right now to look into hypnobirthing because there is no better time to try and remove fear from your life and become open-minded about like meditation and being at a Zen state than right now. Like we all need it. We all need it if we're not pregnant. Mamas who are pregnant need hypnobirthing.
That takes a strong mind though. Like some minds, I feel like, you know, you have to be a little bit capable sometimes to do that. Like,
you have to dominate.
I had like panic attacks like when this first started, and you know, meditation has helped me.
Mhm.
But that's just so I just can't.
It does. You have to be so conscious in your efforts to block out the negativity, block out the fear, and focus on the positive. And it's so important too because you have a baby in you. You know, your baby feels all the feelings you feel. So I've just been practicing that a lot. Just every day, I listen to my meditation and just really try to go to a positive place. If you were going to do another story, I would probably talk about moms who are freaking out should probably look into hypnobirthing.
Yeah. Well, hopefully I can add that to the story today. Yeah, that's very interesting. Well, first of all, you are absolutely gorgeous.
Oh,
And
thank you.
I thank you so much for interviewing with me. This story is going to air at 4 in the 4 p.m. show. I can text you a better time that will be on. Probably you don't want to watch everything stress you out, but I'll
Yeah,
tell you when it's
I've been
gonna be
staying
on.
away from the news.
Yeah, trust me, I would if I could. I'm kidding, but yeah, I've done some positive stories like in all this for sure. But yeah, I'm gonna keep your number handy just in case, just about other stories involving like early on mothers.
Yeah, for sure.
And if you could, like, if you have a picture of like maybe you and your husband and your first baby,
Yeah.
that would be great if you could just send it my way.
Yep, I'll send it over.
All right, I gotta go because Dawn is calling me. But
Oh,
thank
okay.
you so much. It's nice to meet you.
Nice to meet
Your
you.
name's pronounced
Keely.
Kaylee, and your last name is pronounced?
Keely Ford.
Okay, awesome. Thank you so much.
You're welcome. Thank you.
All right, bye.
Bye.